それでは皆様、ただいま武見敬三先生のお話を、横倉会長の後にいただきました。プログラムでは基調講演1の中で、基調講演1、2という形で武見先生にお話しいただくことになっておりましたけれども、武見先生のお話先にいただきまして、基調講演は、これから1題ということで進めさせていただきます。私、この基調講演の座長を務めさせていただきます丸井と申します。武見フェローとしては、35年の歴史の中の第3番目でございまして、ごく早い時期の武見フェローでございます。で、マイケル・ライシュ先生は、この武見プログラムの発足以来、ずっと関わっていただいております。で、本日はマイケル・ライシュ先生にお話しいただくとともに、ジェシー・バンプ先生、それからプログラムコーディネーターのエミリー・コールズさんにご登壇いただきます。で、マイケル・ライシュ先生、現在太郎武見教授でいらっしゃいますけれども、発足当時はちょうど本日おいでいただいているジェシー・バンプ先生のような役割で、非常にフェローが、早い時期のフェローは若き日のライシュ先生にお世話になりました。そしてその役を現在ジェシー・バンプ先生が引き継がれていらっしゃいますし、また、プログラムコーディネーターの現在のエミリー・コールズさんがこの役割というのも非常に大きいものがあります。武見フェローの経験者はすべてその役割の大きさをよく知っているところであります。ということで、今日はその武見国際保健プログラムの歴史、現状、そしてこれからの発展ということで、マイケル・ライシュ先生がジェシー・バンプ先生、そしてエミリー・コールさんにご講演をいただくということになりましたので、どうぞマイケル・ライシュ先生、よろしくお願いいたします。
皆さんおはようございます。私はハーバード大学のマイケル・ライシュでございます。今日は結局基調講演2が基調講演1になりました。私は今から基調講演2でやります。講演は一応英語でやっていただきたいと思います。So, as Keizo said, 35 years seems like a long time, but 35 years also seems like it was just yesterday. You blink your eyes and somehow time has passed. It's really an opportunity for reflection. And I think what Keizo did in his special presentation number 1 was to present his story. And it was a story of personal challenge. It was a story of personal growth. And it was a story of how personal change ended up having an impact on policy that's important not just for Japan, but for the world. And it's a really interesting combination of how learning and opportunity, which are really some of the core elements of the Takemi program, can have unexpected positive impacts on global health. So I wanted to ask the Takemi fellows who are here from Brazil, from India, from Taiwan, from Korea, and other countries, and from Japan, to please stand. So, yes, please give them a hand. Each of these people, these are our friends and our colleagues. Each of these people has their own individual story. of how the experience at the Takemi program changed their life. And I heard it just today. 2 people came to me and said to me, Michael, the experience in the Takemi program changed my life. It changed what I did, it changed how I looked at the world, and it changed what I do. The Takemi program is really a unique example. And I use the word unique here intentionally, of collaboration between Japan and the United States, private collaboration with the goal of trying to improve health globally. I'd like to offer just a few reflections on how this came to happen. If I can get the slides to move forward. There.
Okay.
Okay, this one. Yeah. Okay, so we're going to give you 3 people for one presentation. I'm going to talk about the past, Jesse will talk about the future, and Emily will talk about the present. So this is a photo from 1981. The person on the left is Professor David Bell. The one in the middle is Dean Howard Hyatt from the Harvard School of Public Health, and Dr. Taro Takemi. So it was in December 1981, and Dr. Takemi invited Dr. Hyatt to Japan to talk about mobilizing and allocating resources to improve health, and suggested at that visit that they create a program at Harvard to do this internationally. This was a follow-up visit, and shortly after this, I had a chance meeting with Dean Hyatt. I was a research fellow. I had spent some time at the School of Public Health. I was then at the business school at Harvard. And I met Dean Hyatt at a cocktail party. He mentioned to me he had just returned from Japan and was thinking about this new program. And I said, well, I happen to know something about Japan, and I know something about public health. Maybe I can help you. And so I started from that time in 1982 to put together the proposals for the program that eventually turned into the Takemi program that was officially started in July 1983 when I joined the faculty at Harvard to run the program. The pictures on the side are pictures from past groups, and you can see here this person is now over here sitting he was a little bit younger back then. And this is Dr. Takemi at different points in his life. He was supposed to come as a visiting professor to launch the program in December 1983. Unfortunately, he died in Japan before he could come. This is the picture from the 30th anniversary, which we had 5 years ago. We had 81 past fellows attend. It was a marvelous event, as Keizo said. And we've had many partners over the years. The partnership with the Japan Medical Association has been key. The partnership with the Nihon Seiyakyo has been very important for the financing, initially with the Institute of Seizon and Life Sciences, Seizon Kagaku Kenkyusho, and we've had also some other foundations that have supported fellowships at different points in 35 years. It's also been personal partnerships. Again, this person in the background is now sitting in the front row. It was back when he had hair that still had color in it. And I can say that the personal partnership with Keizo has been one of the pleasures of the Takemi program. So about 20 years ago, I put together some of the principles of the program. This is a unique program because my idea was to have it focused on research that could actually make a difference in policy. It was interdisciplinary, and this again was something that came from Dr. Taro Takemi. As the people who heard the presentation yesterday, he talked about the importance of gakusai teki, multiple disciplines bringing together, and to give people individual freedom. So the program has relatively few requirements. We treat the Takemi Fellows as adults. They have one seminar a week to attend, and the rest of the time is intended to give them opportunity to learn, study, learn something more in depth about their own area, and also learn about other areas. And finally, it's intended to build individual capacity. I wanted to just finish with a personal reflection. A lot of times we do things without knowing what the consequences will be, both in our personal lives as well as in our social lives. I don't think that Dr. Taro Takemi ever imagined that doing this program would have an impact on his own son. He did imagine that somehow the program would have an impact on health in other countries. It was probably impossible to imagine that the impact on other countries would come partly through the opportunity to his own son to learn and change in ways that could affect global health, and that it would then have an impact as well on the institution that he led for 25 years, his own Japan Medical Association. So I think it's worth reflecting that sometimes we do things, both in our personal lives and starting institutions, in ways that we don't fully know what the consequences will be, how it will affect other things, but we have an intuition and a hope that sometimes with a leap of faith, it will have positive global consequences. And I think that the Takemi program is one example of that kind of institutional innovation that has affected individual lives, has affected public policy, and has affected ultimately the well-being of people around the world in ways that couldn't have been predicted, but are very tangible and real. Thank you. So that's the past, and now we'll move to the future and the present.
Thank you, and good morning, everyone. The partnership that Michael has discussed, our long-standing partners in the Japan Medical Association and with the Takemi family, are in safe hands in the future of our fellows. The evolution that we've talked about is a process of going from each yesterday into tomorrow And one of the connections that I'd like to highlight is that as the leadership has changed at the Japan Medical Association, also at Harvard, it's also changed in the Takami family. And it's really important for us to maintain those connections. So I would like to recognize Eiji Takami and his wife who've joined us today. Right. Oh, pardon me, sister. I misunderstood. But with Eiji Takami and his brother Keitaro, who's now living in Washington. The Aso family was with us yesterday, and these are part of the extended family of the Takami program. Maintaining those connections is really important. So what we decided to do in this presentation is to talk about what has happened in the past. I will sketch out our vision for the future, and Emily will talk about how we get there. So one of the things that we've done over the last couple of years is to consider carefully the basis for the Takami program and what it is. And we tried to capture this in our vision statement. We're motivated by the reality that issues of health recognize no national boundaries, and yet every nation sets priorities within those. In order to maximize their limited resources, we work to develop new interventions, new cost-effective interventions, sustainable solutions for the health problems of all. This is the vision of the Takami program, and to do it, we enhance the research and leadership capacity of mid-career professionals. When we realized what we were doing, we tried to crystallize it in the statement. And then we thought, what should be our key goals as we advance this strategy? And we said, well, what we do, we strengthen research. So we provide fellows with resources and the skills that they need. We build connections by creating and fostering a worldwide network of fellows and our alumni and those whose lives they've touched. We do this to save lives, so we support fellows, alumni, and others in leadership positions to design better policies that save lives and advance public health solutions. On strengthening research, what we do in the program on a day-to-day basis is things that Emily will talk about. But basically the idea is that we try to provide the resources and the training that fellows need. So in the future, one of our objectives is to try to endow each of the fellowship positions so that we will be able to fund every fellow while they're in Boston. And we want to foster partnerships for those fellows while they're in Boston and in the world beyond. We want to build connections by holding periodic symposia on a regional basis, and then every 5 years or so, we would like to have international symposia. This enhances the communication and the collaboration within our network and builds its influence for changing health worldwide. To save lives, we want to support our fellows and our alumni as they leverage the research and the evidence that they're doing into better public health solutions. So we would like to raise money so that we can provide small grants to foster collaboration, to get ideas going, to support journal fees, publication charges, to help get knowledge out there. And we would like to do that to help disseminate the findings of our fellows, the findings and the products of our gatherings, and the fruits of our research. These are all parts of our vision for the future, and you can see how they build from what we have done in the past into our vision for how we'll go forward. A lot of this has to do with the engagement of our alumni, the mobilization of additional resources, and the ongoing commitment to the ideals that we all hold. Thank you. I'll ask Emily to come up and talk to you about the present. Thank you.
Hello everyone, my name is Emily Coles. I'm the program coordinator for the Takami program, and I am delighted to be here today. It's really a true honor to be a part of this program. Even though I'm quite new to the program, it's just been a tremendous joy to serve in this position. So I'm a weaver, and so to me, the Takami program is like a beautiful weaving, filled with lots of color and texture and pattern, and all of these different components come together to create this beautiful work of art. So as has already been mentioned, it's a really exciting time for the program. We are in our 35th year. We've had 271 fellows from over 54 countries. And they have done research on a huge number of topics. This sort of just gives you an overview of the wide range of topics that the fellows have covered. So I thought I would just take a couple of minutes to tell you about our current cohort of fellows, because it's a really outstanding group, as it is every year, but I feel particularly connected to this group. So first we have Patrick Banda. He's one of our policy fellows, and he's from Zambia. He is the chief planner of planning and budgeting in the Ministry of Health in Zambia, and his research is focused on determining optimal resource requirements for universal health coverage. And he's hoping that his work at the Takami program will help to shape UHC development when he returns, because they're aiming for UHC by 2030. Next, we have Malit Habtemarian. She is from Ethiopia. She is another one of our policy fellows. She was the Director General of the Ministry of Health before coming to the program, and her research looks at how priorities are set and the mismatch that often happens between the burden of disease and national health expenditure. Next, we have Iranu Rigati, and Marcia Castro, who will be presenting later, is actually Iranu's mentor, faculty mentor. He is researching the way that we can interpret education systems and economic growth. He's trying to develop a tool based on age and grade to help predict outcomes of an educational system, and he's working on a very large data set, over 100 million data points. Next is Go. Go is with us here today in the audience. He is focused on how to create collaboration between occupational physicians and primary care physicians in Japan. I understand from his presentations that these systems often operate separately, and so he's interested in how to bring those two systems together. Mika Kuneda, who's also here with us today, is looking at vaccination coverage and behavior in Niamey, Niger. She's also looking at how socioeconomic factors, such as level of education of mothers and also a sense of community belonging, impact vaccination coverage. Next is Sujata Saunik. She is another policy fellow. She's from India, and she's the principal secretary of the finance department of the government of Maharashtra. She's looking at how to measure return on investment of social-centric insurance scheme in Maharashtra, and she's particularly interested in whether or not this scheme is meeting the most needy. Roland Pangu is investigating some empirical implications of the theory of fidelity networks and how this relates to the spread of sexually transmitted diseases. Next is Sungman Cha. He is focused on community health workers in Ghana, seeing how community health volunteers impact child diarrhea and malaria through results from a randomized control trial that was carried out last year. Hua Young Lee is focused in the context of Vietnam, and she's looking at whether overcrowding in high-level facilities is harmful to patients' financial status and sort of the broader implications that plays in the context. And lastly, we have Tuba, who is a returning fellow, and she's looking at researching the interplay between intrinsic and extrinsic incentives in the context of health system reform in Turkey. So as you can see, we have an incredibly diverse group of fellows covering a wide range of topics, but it's been a real joy to hear what they're researching and to see them progress. So we really wanted to capture the impact of the program over the years. In particular, we wanted to know what led fellows to participate in the program and how has the program impacted them in their professional lives since completing the program. And it's been really exciting to gather these narratives, and the narratives have helped us to refine the way that we communicate about the program. So I hope that you received these when you came today. These are some of our new materials that we actually used for our recruitment this year. So in years past, we focused a lot on recruitment through our alumni network and sort of spreading the word about the program that way. But we wanted to expand past that. So we focused on communicating within the Harvard University network. We sent a lot of information to government institutions, academic institutions, NGOs, and IOs in low and middle income countries. And we combined that with direct outreach in the form of emails and also social media through our newly launched Twitter account. And then a very exciting new initiative is that we now have a fully online application. And so these combined actually led to an incredibly successful recruitment for us. We had over 150 applications, which is one of our most successful years to date. So I want to end on this notion of building connections. And I think it's really important that, that we try to not just build connections within our own network, but we also try to build connections with the global community. So we do have 2 active Facebook groups, and as I said, we launched Twitter in the fall. And we use these platforms to talk about global health issues, current news, alumni updates, and program updates. And I really hope that you will consider joining us. If you haven't received one of these, there are more at the back. These are our social media calling cards, and you can find all the information you need there. So thank you so much for listening, and again, it's a great honor to be here today.
3人の先生方に、武見プログラムの、今まで、そして、現状、そして、これから、どういうふうなことを役割を果たしていくかというようなことについて、光を当てていただきました。このセッションの、座長をさせていただいて、私も非常に嬉しく思っております。3人の先生方、Please stand up, three of the presentation. 3人の先生方に再び拍手を、大きい拍手をお願いします。はい、どうもありがとうございました。非常に楽しくかつ有益な基調講演をいただきましてありがとうございました。それでは次のセッションに移りたいと思います。どうもありがとうございました。